My name is Bill Arsenal. I'm a Wildland Firefighter paramedic, and today we're going to briefly go over some treatment modalities for uncontrolled hemorrhaging usually associated to an appendage area. Before I do that, I want to thank Parma Fire Rescue out of Parma, Idaho for helping me out, and one of the paramedics over here, Kelly Korn, is also going to be my patient. The other thing that I want to quickly brief you is just some of the equipment pieces. Today we're going to quickly discuss quick clot combat gauze, which everybody should have in their trauma packs on their single resource crews, their shop crews, their heli-tac crews, that kind of stuff. The other one is a combat application tourniquet, not the special operations tourniquet, which there are subtle differences, but I'll show both of those to you guys, as well as the Israeli combat dressing. If you are in a position where you can't get one of these, which are an awesome tool to have as well for uncontrolled hemorrhage bleeding, you can augment it using like an ACE wrap and a 5x9, or in this case I've got Coban and a 5x9, and it's the same type of principle. So briefly we're going to just kind of go over some key points to know about uncontrolled hemorrhage. Currently in the Incident Response Pocket Guide, it lists in the medical guidelines section 3 treatment modalities for uncontrolled hemorrhaging. The first one being direct pressure, the second one being elevation, and the third one being pressure points. I'm going to show you guys a couple key things to remember about some of this stuff. Please keep a note that a couple things we've learned off combat operations. By and large, pressure points don't work. To have pressure points work, you have to have a bony surface that the artery lays against to make that contact. If you don't have a bony surface, then having a pressure point utilization does not work at all. The other thing is, with a tourniquet, even though you may not have a large bony structure to support that compression of the artery against this bone surface, you are still going to allow the restriction of blood flow down to that appendage. So we still want to strive to put one of these on. To do all this stuff, we're going to bring in Kelly now, and I'm going to go over just some basic techniques of things to think about. So with the Israeli combat dressing, a ton of them are coming back from Afghanistan and Iraq, and there's a lot of them left. Everybody should have one of these. We've had a number of injuries in the last several years of wildland fire personnel who have had injuries related to saws, Pulaski, shovels, and to help encompass our better treatment modality, we need to be up with the times. So this device right here is pretty unique in and of itself. First of all, it makes it really easy for everyone to read how it works. Other side to the wound. Got that? Great. Okay, the next thing is, I'm going to just use Kelly's arm to kind of demonstrate a couple key principles. This is kind of tied to direct pressure, but we want to step it up a notch. When you come in with an arm injury or even a leg injury, the device again, white side to the wound, and if the patient's conscious, you're going to still maintain that contact. You know, hey, are you allergic to anything? Do you take any medications? Those are going to be your 2 primary questions as you're doing these steps, because if something happens and they go unconscious, those are the 2 pieces of information that most paramedic level type agencies want to know if they're allergic to something or if they take medication. The other piece as I'm doing this, when I wrap this device getting back to the Israeli dressing, I'm going to wrap from the lowest point back up. The reason I'm wrapping from the lowest point back up is I want to push that blood back to the core of the body. So when I do this, I'm going to start right here at the bottom of it. I'm going to do a couple of wraps at the bottom, and I'm going to do them fairly snug. And as you'll see on Kelly's hand, it's going to start turning a little bit of purplish blue. Well, as we all know, that's an indicator typically of lack of circulation, which down here we may want simply because of the injury. So I'm going to keep working my way up now that I've pushed most of that blood back up the core. I'm going to do a couple wraps right here. And then once I've got this device seated, I'm going to finish out the wraps back and forth until you've got it completely covered. Now you have a breaker bar right here. As you can all see, there's a little slit in the middle of that breaker bar. You're going to take this dressing, slide it through the breaker bar, bring the breaker bar back over, pull this as tight as you can, and wrap it around. Now if you're using an ACE wrap or something like Coban, they don't really have anything that holds them in place. An ACE wrap has those 2 cheesy little metal clips, and as we all know, you drop them on the ground, you lost them. The nice thing about these Israeli dressings is they come with little hooks already sewn into the device, which makes it kind of nice because when we are completely done, we just take this hook and we slide it back into the fabric on itself, like that, and we're done. And as you can see, we're not going to lose those little metal clips. Okay, now I'm going to take just a short pause, and then we're going to get ready for a tourniquet. So stay. Okay, so at this time we're going to talk somewhat about the applications of tourniquets. The old school thought of, oh, those are so archaic or we shouldn't do them, that stuff is gone. Numerous pieces of research and data have shown tourniquets are now the life-saving device. If some of you guys remember last year there was an air crash in Reno, Nevada. The first thing that came out of that research that was done by REMSA, which is the Regional EMS Authority for Reno, Nevada and Washoe County, they realized right off the bat they were not going to have enough tourniquets. And one of the key things that they put in their after-action review is every ambulance, every fire truck needs to have more than just one tourniquet on the vehicle. So having said that, these are some of the things that we should be having in our gear, whether it's, again, single resource or if you're part of a crew, every crew kit should have a couple of tourniquets. The first one I'm going to show you is the Special Operations Tourniquet. In and of itself, it's not a bad tourniquet, but that there are some key features that make it a little bit problematic. And when I talk about this, this is based on usually a self-aid, buddy aid type situation where it's just me with my tourniquet and I have to self-care. In this instance, we're going to go ahead and do it as a buddy care, and I've got Kelly again here to help me. But I want to show you a couple of unique pieces to the Special Operations Tourniquet. First and foremost, if you look at it, this is called your windlass. The next piece is you got the windlass locks, which are on this device that hold in each point of the windlass. And then in the other part you have right here is a clamp that still allows you to slide this Special Operations Tourniquet. You have this clamp right here, and in it is an Allen-headed screw. When you're done creating that constriction, you simply tighten this screw back down to keep that clamp from coming undone. The other piece, as you've tightened the strap down, is you're going to lock the windlass in with these two lock pieces that hold it from coming undone. Now, for the self-aid, buddy aid type situation, this is an okay piece of equipment to use with one minor exception. For self-aid, it's much harder to get your hands to manipulate all these different pieces. So to mitigate that, the device that we're going to be using, or that we suggest most folks carry in their wildland gear, is the Combat Application Tourniquet made by North American Rescue Products. It's the one that's pretty much industry standard for all special operations, special forces, Marines, sailors, airmen, and grunts alike. And I say grunts because I've been one. So to use this device, it's a little bit easier to use. There's a couple key features to it when you set it up. The first piece is, most of them is going to have a tri-lock buckle. When you bring this piece in, for an arm, we're going to set that tri-lock buckle on the first strap, just in that first hole. The reason being is, we don't have a lot of muscle within our arm area. When we do this, we also want to get this as close to the wound as possible. That has come from all the studies that have been done, as well as the new orthopedic surgery procedures that can be done for prosthesis. The old school thought was, try to put it up above a joint. Well, now, it's get as close as possible. That gives those surgeons more room to work with. Not only that, but the more muscle mass that you involve the tourniquet on makes it much more difficult to create that constriction because you're working against all of that muscle mass. So as I bring the bone back in, you got bone, you got artery. Well, on a leg, it's not a big, on an arm, like a lower arm, it's not a big deal. But as you get higher and higher up into that area, you've got all this surrounding tissue. And to try to create that constriction, it makes it much harder to do. So from now on, get that tourniquet as close to the injury as possible. So on Kelly's arm, we're going to use Kelly again. We're going to show you the arm. Again, our windlass, we've got locks right here. She's going to bring her arm in. Let's say she's got an orthopedic injury with major trauma, major vasculature damage, and she's got arterial bleeding. We don't want to waste any time. We're going to come in, put that tourniquet on. Remember, we're going with just the first eye slot right here. We're not going to worry about sliding it through that because we're working with a smaller surface area. Pull it as tight as you can in the Velcro. Take that windlass, twist it as tight as you need. And with Kelly, I'm not going to go super tight. I'm going to just show you for demonstration purposes. We're going to go ahead and once we've got it constricted where we've stopped that blood flow, we're going to lock it into the horns and put the Velcro tag over it, and that keeps that from coming undone. Much easier to accomplish these tasks when it's by yourself than trying to get all these different steps accomplished on the Special Operations Tourniquet. Where it's going to be just a little bit different is the leg. And as we do this, remember, we're working with much more muscle mass in the leg. So to accomplish this, I'm going to have Kelly throw her leg up here on the end of the table so you can see what I'm talking about. Okay, so if we have vessel damage or a major muscle involvement on a leg, we're going to take this tourniquet and we're going to go in both eyelets of the buckle. The reason being is we need to create as much constriction force as possible. To do this, you go in the first hole, slide it as tight as you need it, and I'm going to keep this windlass stick on the outside of the extremity. That makes it easier for me to work with. I can also see it, and it gives me more room overall to complete the maneuver of twisting it versus having another leg right here. So I've got the first slit filled with the strap. I'm then going to come in and fill the other slit in the tri-buckle as tight as I can get it. Pull it snug. And we're going to say here muscle involvement right here. We got a big muscle, lots of popliteal artery coming down. We're right next to it. We're going to twist this device again as tight as we need it. And then I'm going to lock it into the horn just like that. I'm going to Velcro it. Remember, the final steps for anybody that gets a tourniquet, we need to make sure we mark them on their forehead. I suggest for all of our federal law enforcement guys and wildland fire guys that they carry a Sharpie marker and then go ahead and put that marking on the forehead. At this time, this is about all the steps, and if you have any further questions, please feel free to shoot me an email or give me a call. Thanks, and be safe out there.